Hey everyone, welcome back to the Wild Health Podcast. We're a genetics-based precision medicine company that's exploring all the big questions around holistic health, wellness, and performance optimization. If you're tired of the traditional healthcare system and want to sign up as a member with us, head over to wildhealth.com. And if you're someone who's looking for a high-touch, all-inclusive concierge medical experience specifically designed for executives and high performers, check out our premium program at wildhealth.com/premium. Now let's get into it.
All right, so welcome back to the Wild Health Podcast. Really excited to have Dr. Carl Seeger from our team here. And Carl, I'm even more excited to have Dr. SanDeep Prakash here with us. He's the Chief Scientific Officer at SoundSelf. So Dr. Prakash is a psychedelic researcher trained at the California Institute of Integral Studies. He's an expert in leading psychedelic and digital therapeutics research, has over a decade of experience in transformative experience design, and is currently at SoundSelf. Just to lead off with it, soundself.com if you want to find out more. Overall, we're going to take a look at the value of therapeutic technology today. We want to get into the story behind SoundSelf, the patient-practitioner relationship, integration of ancient technology and modern science, and the future of mental health. So, just a quick topic, nothing major to really get into there. SanDeep, can you tell us a bit about SoundSelf and sort of what the story is behind the evolution of where you guys are today?
Sure. SoundSelf is an immersive technology for mental health. It has a pretty long history. It started inception was about 8, 9, 10 years ago when a game designer, Robin Arnott, had a experience in which he had a full vision for what SoundSelf could be. So Robin had a visionary experience, and he was working as a game designer at that point, and he was really interested in how he could design games that can radically change people's mind-body state. And he developed it. He released it on the VR market, which at that time, virtual reality required expensive gaming computers. So it was a headset that was tethered to a gaming computer, and he was running a VR distribution company and sort of incubating SoundSelf in that company. And in, let's say, I think it was 2018, 2019, I was in Austin traveling over the summer, and I was about to start a research study on flotation tanks. And I was at the time just interested in technologies that could bring people into states of consciousness and also teach skills in those states that could help with mental health that were just much more accessible than psychotherapy or the prevailing tools that we have right now. Because, in my background, I went to California Institute of Integral Studies, as you said, to learn about psychedelic research and to train there as a psychologist. But my passion, why I decided to become a psychologist came from psychedelics, shamans, but also studying yoga in India. And both of those experiences, I realized that there are so much profound tools that can be learned, but that are hard for most people. Just don't have the time or money to learn that. So when I tried SoundSelf in Austin, when I met Robin and tried it, I totally changed my research study that I was about to do at the time, and was like, this is something I want to understand more. And so we did a study on that. After that study, we got together and launched a new company, SoundSelf, to bring this product into wider acceptance in the medical community as a digital therapeutic. So to do rigorous research, to make claims over mental health conditions, take it through the FDA, and bring it to people, and so that it can be accessible and insurance reimbursable is our vision.
Hey, so SanDeep, I was fortunate enough to try this in Denver at Psychedelic Sciences. And you and I briefly met at that time, but you had like 50 people around you all trying to line up and try this, but maybe you could start with, what is the equipment? What's the experience like for patients? Like, what are all they looking at, from your perspective, and kind of how you designed it and why you designed it that way?
Sure. So you come into a room, and usually you'll have if you're doing it at a clinic, the clinician will explain to you what you're about to experience. But you put on these glasses that have LEDs on them, and you put on headphones that have a microphone attached to it, and that's powered by a computer. And so our software lives on the computer and powers this hardware equipment. And optionally, there's also a vibroacoustic mat that you can lie down on. So as you lay down, you put on these glasses and close your eyes. A guide comes in, and the guide does a meditation to get you relaxed, feeling into the body, and start to bring your awareness gently into your breath. And then you start to tone, like, ah. And as you tone, the system is intelligently listening to your voice and generating a musical world as well as the visual world using the lights on top of closed eyelids that's designed to put you into a trance state. So you're toning for, we have different session lengths, but the main session is 45 minutes long, because we found that this is the optimal time for someone to really sink into a deep state. So you're toning throughout the experience, and the system is designed to generate this trance state. And it was designed to do this. It was to bring the user into a state of consciousness where there's neuroplasticity and change can happen. So one of the main features that it's designed to do is to reduce the functional connectivity of the default mode network, which is, been variously attributed to like self-consciousness, to being like the center or top of the hierarchy of functions in the brain. And when you quiet down the default mode network, so to speak, it's reducing that mental chatter and attributing labels or perspectives to things. So it reduces the perspective taking so that you're more in a flow state. So that's one aspect of it. But the second thing is to have your voice, your tone, generate the musical system. So you're hearing your own voice as well as the musical system in there. So it's designed to be very playful and fun and interactive, but also something about the voice, because it's so intimate to the person, to you, when you're doing it, it really connects you with yourself in this very peculiar way. And in like the whole world of the psychology of VR, one of the things we talk about a lot is like presence and immersion. And I think what is common to a lot of VR therapeutics is how we modulate one sense of self. So in SoundSelf, you're taking a perspective on yourself, which is coming from a place of compassion, and because you have nothing but all the other external aspects of the world is reduced to a set of phenomena, which is basically yourself, your chest, your body, and the immersive world that's created by the visual experience. So it's like this quasi out-of-body experience where you're both in the body and out of the body at the same time. And then what that does, combined with that neuroplasticity I mentioned earlier and the reduced functional connectivity to the default mode network, it allows you to be with yourself in this soft, simple way. And then any phenomena that are arising, let's say an anxious thought, or maybe rumination. Let's say maybe you're depressed and you've been suffering from rumination. If it does arise, it's something that it gives you the capacity to work with in a creative way, rather than something that could continue it to that energy being like a coping mechanism, negative coping mechanism. So, and there's a variety of other therapeutic mechanisms in there, but Yeah, that's kind of like the gist of what it is and why it's designed like that.
Yeah, I would just share that I've had the opportunity to play around with a loaner device to get my hands on it and become more familiar with the technology. And one word of caution, if you're ever doing it at home, is make sure you tell your kids what you're doing before they pop in on a room and see you with these flickering LED glasses and a headphone on doing vocal tonations, because there was a little bit of a what in the world is happening in here. Some of the kids walked in on me during one of my sessions. I would obviously that's an edge case scenario where you're doing it at home in your bed right now. But where do you see SoundSelf plugging into the existing mental health framework and network? Is this something where you really envision sort of a supervised experience or a telemedicine supervised experience, or is this going to, in the long run, is this like a direct to consumer product? I'd love to get a sense of sort of like big vision, and then maybe we can sort of transition from that into what sort of clinical evidence are you guys currently working on, and where are you at in terms of showing impact on patient-oriented outcomes?
Yeah. So right now it is a supervised experience. We sell to clinics that are typically working with ketamine. One of the, I think, most obvious use cases that we found and why we're focusing on ketamine and psychedelic therapy right now is preparation and integration. There is a huge demand for preparation and integration by need. So there's to take full advantage of ketamine and psychedelics, it's clear that people need access to tools that help them on the preparation side and integration side, including psychotherapy. But there's just not enough clinicians and not enough resources out there to provide that tools. And I do want to say something about the vocal toning. So the vocal toning is something that I guess what we're also doing, and one of the therapeutic mechanisms is bringing in ancient technologies, something that humans have been doing for millennia, and packaging in a way that it's accessible. We in our modern society, we don't think about it much, but chanting, and especially chanting in a group, and using your voice like that it's been done since who knows how long, and for a reason. Like it brings us into profound states of consciousness. Just the other day, I was doing a demonstration of SoundSelf, and I did the demonstration of SoundSelf at the end of this lecture where I presented on sound, various ways that music is used therapeutically, and kind of looking at different cultures where music and dance and ecstatic trance is done for healing purposes. But I got the group to just get them to understand what vocal toning is. I got the group in a circle, and we did vocal toning for just about a minute and a half, 2 minutes. And none of them had done that before. None of them had just doing that together. Like you may have done like maybe an Om at the end of a yoga class. And one of them said that it was one of the most like therapeutic experiences that she's had in that sort of setting. And vocal toning, there's limited literature on it in how it's used, how it could be used in a music therapy or therapeutic environments. But what we do know and what's out there, it seems to be teaching mindfulness faster than you would be able to do in a didactic mindfulness training fashion. And part of the reason is that you're sort of internalizing that sensation. So you're directing it through the toning, and you're also reducing the set of phenomena that you could possibly be concentrating on. So part of the challenge with mindfulness is that you have to concentrate on one or just maybe 2 or 3 things and get rid of all the distractions. But with toning, because you're generating that, it makes it a lot easier and simplifies that process. And oftentimes in yoga, and actually in the yoga tradition, in the classical yoga tradition, almost always meditation starts with mantra, the chanting, because it's a first step that makes it really easy and locks in that mechanism of concentration. But so back to the clinic. So why we're doing it as supervised experience is one of the reasons is precisely that. Like it's a new sort of behavior. Like you expect to go into clinic and something to be done to you. But we've reached an era, I think, and I think a lot of consumers of health are also understanding this, is that it's less and less of a passive thing where something is done to me, like or like I take a pill and it just does all the work. I think people are realizing that if they step into the healing process in a meaningful way, that it's that there's better outcomes. So we have a clinician supervised. They give education on what SoundSelf is, how to best use it, how to come away from it, and what they should do at home to take full advantage of that practice. So we're developing protocols right now with these ketamine clinics and psychedelic therapy practitioners to how to best use it. So typically we're seeing someone come in 2 to 3 times for preparation and 2 to 3 times for integration following ketamine or psychedelic dosing. So yeah, we can dig into that more if you want, like on the preparation integration side of why.
Yeah, I think.
Yeah.
Why don't you go to that now, Mike?
Yeah. I was just going to say, I think that's a phenomenal direction to go. So I many ketamine practices, and I'm biased, but the ones that I admire the most have a significant preparation. A long intake, get to know the person, have them work on, preparation in whatever techniques that might include, where it's typically, some form of modification of alcohol intake, sleep, breath work, meditation, journaling, nutrition. There can be all sorts of different factors and levers that are pulled to get someone ready for that kind of experience. And then afterwards, obviously, integration we know is super important, right? I mean, if you're going to distill it to its basest, most simple takeaway form, talk therapy has a role, ketamine therapy has a role. You put those two together and, incorporate talk therapy in the setting of a more neuroplastic background, and you're able to really make some incredible strides in terms of mental health. I'd be really curious to hear about how ketamine practitioners are folding SoundSelf in terms of frequency, timing around a session. Is this something where you have a SoundSelf session and then go into a ketamine infusion, or is it more of a distinct encounter for patients? So just would love to hear what people are doing these days with it.
Yeah, so what we're advocating is definitely a patient-centric conceptualization of preparation integration, that they should be empowered to step into their healing process, because it starts with the person. I think, creating a story and analyzing their own stories of their whole life journey, and there's of course a whole bunch of other things, nutrition and all these other things that we can provide education on. But if we can provide them with an experience, and that SoundSelf does this, is that where they feel like they're stepping into their healing journey in a meaningful way and making meaning out of it, it starts this graduated process where each time they do it, they go back into that ultra state and get the sense of, I'm doing this for a reason. What are those reasons? And then it gives this empowered feeling of, I can enter into a state of consciousness where what I'm suffering from becomes less severe, and I can kind of work around it. I can look at the ways that it's manifesting in my life. I can get more perspective. So what we're advocating is that people do 2 to 3 sessions leading up to the ketamine experience, so that they get a taste of, if they've never done a psychedelic before, you can get a sense of what is an altered state of consciousness without taking a drug. So there's can be a lot of apprehension if you haven't done ketamine before, you're like, oh, it's it's an anesthetic. What is this? It's not. Is it? There's maybe concerns over, the FDA just released that guidance, over at-home ketamine. So they may have read that and they're just kind of like, okay, what is this? Is it going to work? There can be a lot of questions, but doing SoundSelf is a great way to reduce that apprehension and anxiety going in. And so what we're seeing and what our clinics are reporting to us is that it virtually eliminates someone's like pre-dosing anxiety. So that's a huge benefit. So that's the primary, I think, thing that that clinics are seeing in the preparation side is getting people in, reducing that anxiety before taking ketamine, and then starting that process of meaning making. And that's something we saw in one of the research studies that we did, is that something that tied together a lot of the other therapeutic mechanisms is psychological meaning making. And we often kind of, from the mechanistic perspective, we have to reduce things to what is the mechanism in the device. But with these new emerging class of technologies, it's not just the mechanism in the device, but they are designed to be like a participatory thing between the user and the system. And so it's the person's psychological meaning making is taken into account in the whole design, in the design of the system. And then on the integration side, one of the things we're seeing is that it can reactivate insights or memories from recent psychedelic sessions. So part of this process, so you start the story making process in the preparation side. It goes and you have an ecstatic trance, an ecstatic peak experience with ketamine or other psychedelics. And then on the integration side, as time goes by, you could, habits don't go away, and you're still having to deal with life and living day-to-day life. And especially if you have a mental health condition or substance use disorder, those habits and habits of mind aren't going to go away from taking the psychedelic. But what we're seeing is that if you can embody the insight and have that be a living force in your psyche, it's something that can provide energy towards in that positive direction, then that can improve overall durability of effect of the psychedelic or ketamine itself. So, and how this is the training we provide, we kind of go into this in depth with clinicians, but you want people to, when you're putting on the integration side of things, you want people to embody an insight they have had as much as possible, to feel it in their body as much as they can and anchor it. And so when they go into SoundSelf, it can deepen and anchor more fully into their embodied life. So a lot of the insights from psychedelics and peak experiences it's not necessarily linear or a fully cognitive type insight. It could have something to do with mystical qualities. It could be like infinite love, or it could be a certain quality of energy I want to bring into a particular relationship, or any number of things. But the point I'm trying to make is that it's not necessarily a cognitive thing. And by going into SoundSelf, you get in a super deeply relaxed state of consciousness while maintaining a sense of alertness. So it's this sort of sweet spot where you're super really, really relaxed into a theta state, but you don't fall asleep. It's similar to a state in a yoga technique called yoga nidra. But that's the sweet spot you want to hit. And by being in that state, when things emerge, you can interact with the stories that are maybe happening in your life. But you can anchor that insight more deeply into your life, which is the main thing in the integration protocols.
Yeah, that is the thing. Hey, so SanDeep, I think we want to get in a little bit more into the research of this, but before we do that, I wanted to pose a question to you that came up after my experience with your device, with SoundSelf in Denver. A bunch of us went through this, and it actually has stimulated a really interesting conversation that, and I'm interested what you would say to this, is there's sort of people who would say that you're kind of using an unnatural device to generate this audiovisual world. And on some level, it's you're not allowing people to kind of, or not that you're not allowing, but people are kind of bypassing the work to get to that space to themselves. And it's actually a similar argument to some other things in the psychedelic space. But this conversation we had over lunch with many people kind of brought this up, and I'm interested in what you would say to that. This is almost like for lack of a better term, like a spiritual bypassing, and people are not able to access this themselves, that they're using an unnatural device to get to that state.
Yeah, I mean, I don't know if I would say spiritual bypassing. I would say it because I think that's more like when, there may be like let's say an experience that causes some sort of ego inflation and phenomena that should be attributed to like the web of life or something like that is attributed to self, or but I see what you mean. Like, I would say that there's nothing wrong with having a tool that can get you to a state, but we don't want reliance on it. And so we see it as more of like an educational tool that, someone can learn how to do that in their own life. And that's part of what toning can do. If we can introduce toning and doing this immersive experience and getting to a state, and that's something we train our clinicians in as well, is, when the person gets home, that they practice toning in order to access any sort of insights they may have had during the SoundSelf session. So it's basically locking in the story of doing a preparation integration each time you do SoundSelf, so that overall the skills for preparation and integration are building over time. And one of the things that I think we're just in need of these type of skills training tools. Like previously, we may have had elders that taught it to us over time. We had opportunities for us to learn this, but if we can package it in a way, then I think we can help a lot of people. If we can package it in a way that's accessible and we can learn it much faster. And so skills of attention, absorption, and mindfulness. We need the more that's out there, the better off people will be.
Yeah. I kind of view it as, people are so wrapped up into their default motor network, just in their head, that this is a tool to kind of give people a glimpse of what is possible. And that then opens up so many other doors for them. And that's kind of how that's how the argument landed for me in Denver, but I don't know if that speaks to you at all.
Yeah, definitely. I think that, there could be any number of things that could open a door. But if we can do it in a controlled way where we can really show the person, okay, what is next? And that's what we do in SoundSelf. We provide both the intro to the toning, where we educate, like we provide a lot of education on like toning and like how to really get into it in a relaxed way. But then we close the meditation so that you land back into the body, and you're encouraged to go on an inquiry of where this feeling goes after the experience. So we're very explicit in the content so the closing meditation, which is it encourages the person to go on their own inquiry of where that feeling is taking them. And so it's partly it's the state of consciousness, but I think something that's often discounted in like the psychedelic in psychedelic science in general is it's not necessarily a state that a person is in, but is the whole inquiry process. Because we can't be in it. We're not in one state at any given time. And it's, I think, a blessing if we have tools that can give us this perspective, can open a door, but in a fashion that is productive and generative.
Yeah, I mean, I think we've all heard the the axiom that it's not about altered states, it's about altered traits, and I think that that's 100% true. Right? We're not entering into psychedelic clinical sessions with patients to put them into the objective is not the altered level of consciousness, or the non-ordinary state of consciousness, or whatever term you like for it, the shift in state. The objective is to shift traits, to make people feel more connected, to be more mindful, to get improvement in their treatment-resistant depression or PTSD or anxiety or whatever other mental health conditions they may be suffering with. My 2 cents on that,
Exactly.
Carl, not that you asked, Carl, but my 2 cents is, we've been doing techniques as humans for thousands of years to induce these sorts of, insights and transitions in our day-to-day awareness. And whether it's fasting, or it's sweat lodges, or it's chanting in a group, or it's the use of medicinal plants or psychedelic psychoactive plants. I have a 16-year-old boy. Video games are certainly a lot more accessible to him in his current day and age than chanting or sweat lodges or fasting, or thankfully psychedelic medicine, because he's only 16. And I think the ability to have something that really is I look at this technology as having so much promise as, almost just an introductory way of shifting your states of consciousness without having to take on faith, hey, I really want you to sit here and focus on your breathing for 40 minutes, right? That's a tough barrier of entry to a lot of people. And it's much more engaging in that way, which I think is really exciting. I'd love to hear a little bit, SanDeep, about what active clinical studies you have going on. And I'm just going to ask the question about the study that I'm wondering if it's going on up front, and you can just either say yes, no, or it's coming, and elaborate. But is anybody using SoundSelf in combination with active ketamine therapy? So you've got the headphones and the microphone and the glasses on, and your eyes are closed, and you're in a supervised clinical setting where you're receiving a ketamine infusion during a SoundSelf session. And if not, that's great, but just have to know. And then what sort of active clinical research are you guys doing?
Yeah, so that's definitely happening. We've heard from physicians that have been working like that with SoundSelf, and there's a lot of promise there. We're not working on any active studies for that, so like combining it in the same session. And we're also not providing any sort of like protocols. We're trying to learn if and when people are taking that initiative to do that. And what seems to be happening is that it turns a microdose into a macrodose. And so I did it myself. So, I met a doctor, and he was interested in having me do it. So I did IM ketamine, which is a small amount. I think it was like 30 milligrams or something like that. And I did SoundSelf, and it was very, very fascinating. It turned it into, I would say, more of a transcendental type experience, and a more like euphoric, while at the same time having a lot of insights around, like for me, it was about like creativity with my like voice and power of the voice. But there's a lot of potential there. I can't speak too much on it yet because we are not doing the studies, but we're definitely interested in that. And I think a lot of physicians are interested in that because there's an interest in that question of, and I think all doctors, or, the ethical side of their, physicians training compels them to ask, what is that least amount of medicine to use to have a beneficial effect for that person. And I think so that for that reason, there's a lot of promise there to pair ketamine with SoundSelf. And we have so there is a patient in there's a clinic in South Florida that we're collaborating with, and they're we're doing a study right now, and I can get into that, but they are about to launch a study. One of their clinicians is at Florida Atlantic University, and they're about to launch a study looking at the SoundSelf in a preparation integration protocol. But they have patients that really like to do so Spravato. Spravato is mandated. I think the person has to be in the clinic for a certain amount of time. And so on the second hour, let's say they have Spravato in the first hour, and the second hour when they're coming off it, they really like doing SoundSelf. It provides this aspect of like continuing that sort of visionary experience of exploration, but it also has this grounding aspect to it. So SoundSelf can be because of the chanting, it feels like you're both grounding into the body while as connecting to this sort of visionary experience.
And SanDeep,
Yeah.
sorry, just to pipe in, just for listeners who might not be familiar, Spravato is the brand name for S-ketamine, which is the only FDA-approved indication for ketamine for mental health at the moment, and is given as a nasal spray. So that's when we're talking about Spravato. That's what we're talking about. Sorry, Cindy.
Yeah, and I think really tools are just really, really necessary. And I didn't know this, but as I've been in this work, with Spravato, like because of the insurance, how the insurance works and all the sort of regulations around it, people are coming to it oftentimes after failing two antidepressants. And I think we need not just SoundSelf, but I think digital therapeutics really need to step up and have a place here, because there's so much that can be done in terms of the psychoeducation and other tools that people can have that to take full advantage of ketamine and for its therapeutic effects. But anyway, yeah, we're involved with a number of studies. So there's some external studies happening at universities. So Imperial College London Center for Psychedelic Research is doing a study using LSD microdosing. And so they're using SoundSelf as a creativity measure tool to see if, how people are using their voice, and does microdosing LSD lead to, more creativity. And so they're using SoundSelf as a tool to measure that sort of embodied creativity. And on in University of Milan in Italy, they specialize in psychological research in virtual reality, and they're doing a study on looking at the psychedelic qualities of the experience, and essentially looking at what are the outcomes if we think about SoundSelf as a standalone psychedelic, for example. And then we're doing an observational study with a lot of our clinics are participating in that. We're recruiting 40 people looking at pre-post measures around mental health conditions and a variety of measures, kind of to understand the mechanism of action and to look into honing in what the sort of therapeutic indication we eventually will go after. So we're interested in things like anxiety, depression, PTSD, substance use disorder, and so we're kind of just casting a wide net right now and getting as much data as possible to do further research. Yeah, so that's the main study where I just got done with the grant application, so fingers crossed I get that. We're looking at we'll know in January, February, but this would be to look at SoundSelf in underserved populations. So one of the promises of DTX, digital therapeutics, is that it makes accessible things that are not not accessible, like psychotherapy or other types of health interventions. So we're as a company, that's something that we're really passionate about too. So we want to study SoundSelf and design it especially so that it's usable and acceptable within many populations. So we'll know in January, February when we'll launch that. And the other one I mentioned that's about to start is like a ketamine feasibility study, looking at SoundSelf as a preparation integration protocol for ketamine, and how that works with patients, how that works with clinical workflows, interviewing doctors, things like that.
Amazing. I don't know how much of this is stuff you're able to share, but I'll just ask, like, are you guys, I know you're likely working, you already mentioned FDA, likely working towards, having software as a medical device clearance from the FDA as part of the vision. Do you have a sense of what the primary indication or what you would pursue from FDA first would be?
Yeah, I'm not able to like kind of talk about that much. But the research that we're doing now is giving us some clarity over that. But it's likely going to be a place that we can enter that, the thing with SoundSelf and actually a lot of immersive therapeutics is that, you have to navigate this challenge between doing rigorous research and getting that data, and then you having through the FDA process, and then convincing payers. So it's this sort of balancing act of like, okay, what indication can best be served by this, and what the data shows. But then also there's a lot of other indications that could be that could benefit from this as well. So it's something that as a company, we're continuously kind of going back and like analyzing this, the balance between, okay, how do we commercialize and how do we do the research and how do we, get this into the market in a sustainable fashion. So yeah, right now we're not making any mental health claims. We're a wellness product, and so we're in the market right away. It allows us to start interacting with our customers and getting feedback. And so our main objective over the next 6 months is to do the research that will shine a light on the indication, but also to all the data we're getting from our customers right now is putting it back into development and making the next iteration of the product that can be targeted. So we use AI in a number of ways that is, I think, really innovative. Part of it is how the system is listening to the voice, but it's also how we're personalizing it. So every time you do the experience, it feels unique. But what we're gonna start doing is personalizing the length of the tone to you. So we're gonna kind of assess where the person is at as they start toning, and be able to incentivize either longer or a little shorter tones to get a sort of rate of toning that is optimal to sustain in a particular state, like theta state. So that's a lot of the work we're doing, is kind of to understand what indications will best be served if, let's say, you maintain a flow state in a theta state, or if you maintain it in other types of brainwave entrainment like beta, alpha. And then we also do a vocal biomarker analysis. So at the beginning and end, there's an elicitation of like, how are you feeling in your body? And the person talks out loud for 45 seconds. And we get a snapshot before and after of mental fitness. And the mental fitness is a construct that has been tied to PHQ-9 for depression, GAD-7. These are validated questionnaires. So, this company we partner with, SoundSelf, has established these data sets where they can give a mental fitness score. So that's just, so we're working on things that people can get a before and after snapshot. The clinician can get a dashboard. So they'll see, okay, a person has come in 2 or 3 times before their ketamine journey. We're seeing that they're improving in their ability to stay in a flow state, ability to go into what their respiration rate is over those sessions, and then also that mental fitness score. So yeah, it's we're on a learning mission and a development mission to get this product into make it as effective as possible for people.
All right. Well, thank you. One product request and one follow-up research question, and then I'll let Carl get a word in edgewise here.
Cool.
My product request is, can I make the voice into an Australian female like I can on Siri, at some point maybe we can just tweak who's talking to me. Obviously that's like only half kidding.
We're working on all that.
Yeah,
awesome.
Can we make it not my voice? That's what I really, because I just don't want to
definitely don't have
voice.
it be your own voice, Carl.
It's like, it's like watching a crime scene. Gotta look away.
And then I'm intrigued by and it certainly resonates with me, your experience at what I'm going to call somewhere between a 0.3 and a 0.6 milligram per kilogram intramuscular dose of ketamine, just like in as much as I can guess your weight like a carnival trick over Zoom. But 30 milligrams of ketamine for a grown man adult, somewhere probably like 0.4 milligrams per kilogram, more or less. That's a pretty low dose, right? If we look at the medical literature on treatment-resistant depression and the highest clinical quality, most rigorous studies, they all typically use around 0.5 milligrams per kilogram. So, and those are, in clinical experience, often not dissociative, not like, tremendously, spiritual, would score very low on like a mystical experiences questionnaire on average for a dose at that level. Mm-hmm. So curious, we know that combining things like breath work in combination with ketamine therapy can allow patients to have, really more subjectively impactful experiences. Now, we'll put aside for a second whether or not that means that they're more therapeutic, but more subjectively impactful experiences with lower doses. Are you working with anybody right now looking at dose adjustments? So like a ketamine clinic that's looking to say, hey, if we used SoundSelf in conjunction with our regular protocols, could we use a lower dose and either achieve similar or even potentially better results?
Yeah, we're working on clinics kind of like in a loose way, but that's something that we want to formalize. And that's something that we need, we need funding for. I think there's a lot of interest in that, and it's something that we're going to seek to do next year. Is to do a study in terms of that conjunction of ketamine and SoundSelf and the dosages.
That's
awesome.
Exciting. So I have a.
I promise, Carl, you can get a word in edgewise.
Yeah. Can I go now? No. So anytime we're thinking about a procedure or device or medication, we think about contraindications and also risk and downside. So what would those be for this device, considering contraindications, or I guess just patients that you would advise not doing this with?
So we always ask the clinicians to screen for any sort of photosensitive epilepsy. So if anyone's that has a photosensitive epilepsy, and also just risk for seizures from flashing lights. So that's the only one we ask them to screen for. But we also ask them to use their discretion when working with populations with like schizophrenia or bipolar disorder. Because it's the sudden state change. It's up to them. So we ask them to, they have to be responsible for that as clinicians. But in terms of just a contraindication from the mechanism of the device itself, it's because of the strobing lights and their intensity that we want to screen out for people that could have a seizure. Okay.
Any other populations you'd be worried about or you avoid this with?
So for our current research, like I said, we're screening out for bipolar and schizophrenia and people who have had, very recent suicidal ideation. But that's more kind of tailoring toward the requirements of like other sort of things we're trying to balance in doing a research study. I would as clinicians, when we give them that when training, we kind of ask them to use their discretion also with children. This is something that we've mostly done with adults, but we've had teenagers and younger adults do this and had healing experiences and had came out of it with having really good experiences and therapeutic experiences. But with children, because of the nature of going to altered state of consciousness, if like they're very young, like 6, 7, 8, they can be the risk of maybe encountering phenomena, thinking it's real, or having like a derealization or depersonalization. Because we know from virtual reality, the literature on virtual reality, that kind of you want to be careful with children. Our device is little bit less of a concern because we're not presenting any realistic visuals, and so visuals that are attempting to be realistic. So the visuals that you're seeing is created by your own brain because it's flashing LEDs on your eyelids. So it's like abstract geometric patterns that are constantly changing. So so far in the clinics and the clinical settings that we're in, we haven't gotten any reports that we should be, careful over certain populations. We have people in clinics that are treatment-resistant depression, anxiety, PTSD, and substance use disorders that are getting benefit from it. So,
okay,
yeah.
So, I guess I'm interested in, just because you're in this space, is what do you see the future of like mental health therapy evolving when you're combining? How do you see this evolving when you combine, other modalities that are evolving rapidly, as well as these digital therapeutics that you're developing? And what do you see that looking like in the future if you sit back and have your creative mind kind of wander? How do you think things are going to look?
I think the ambition with or the aspiration whenever you're working with someone is to be as individual as possible, kind of draw on a general knowledge, right? And draw on best practice, but to treat the person as a whole. And I think we're going to see that into an infinitely greater degree into the future with AI and immersive technologies and other tech. So where our tech plays a place is in this, it's going to be ultra personalized experience. I think that there is, just how we were talking about preparation integration, there's so many things that you could potentially do or give a person in terms of education, but at the end of the day, it's up to them to step into that healing journey and to make meaning out of it. And so they have to have agency over that process. So, I think the future is something, it looks like, where it can be very ultra personalized using AI and large data sets. And so what we're working on is to develop the large data sets on people's respiration rates over time, how they're toning throughout the experience, and what their ability is to stay at a flow state at various brainwave these various brainwave states. So the different rates at which the lights are flickering. And so what we want to do is be able to personalize it to the person's both, how they are in the moment in terms of how they're interacting with the system, but also we're getting data on, like PHQ-9 and GAD-7 and other questionnaires, tying to the rest of the data the system is doing. So we want to be able to target, like, let's say you can go into SoundSelf and you can target specifically depression, or target specifically social anxiety. So it's like I see it as ultra personalized and therapeutics for the person, and ultra accessible too. Something that you can do anytime and anywhere you are.
Yes, indeed. I'll just say one more thing. My experience with SoundSelf was pretty profound, and I totally agree with you. As this is almost like the perfect sort of device to have people who are hesitant around psychedelic assisted therapy or haven't ever had an experience with any sort of altered state, and this being a lead in to that for people, but also not just that, but then also on the back end as something that's very accessible, that is very that they can use as a tool to adjunct their other practices. And I think it's a great device, and I think what you're doing is pretty amazing, and partnering technology with sort of ancient thought processes and tech practices with modern technology, which not many people are doing or doing well. So I think you're doing a great thing.
Thank you.
Awesome. Yeah, I mean, if you're you were at a CIIS, so you may already be familiar with Patricia James, but Patricia talks about the braided way, and sort of prophecy of indigenous people, speaking to the practice of braiding together traditional earth or ancient wisdom and contemporary sky or modern technology to create something new that kind of interweaves and is even better than either one by itself. So I think a really inspiring path you guys are going down. It also, just in terms of all the, just to piggyback on what Carl said and add one more thing, it's pretty challenging to go into to envision a world where everybody has the time and the financial resources and the bandwidth to have regular, 1 to 6 hour psychedelic experiences that they need someone to drive them home from and then recover from and then integrate from. But digital therapeutics, obviously, number one, way more cost effective. Number two, you can come out of a SoundSelf session and go cook dinner for your family. I can attest to that, having done it. And there isn't a recovery period where you're really needing support from people around you. And if you're working demanding jobs, you have responsibilities. That's something that I think doesn't get talked about enough. Just the socioeconomic and cultural barriers to more of these potentially really beneficial therapeutics. So I guess last things last, really appreciate you coming on and sharing your wisdom and the company vision and sort of what you guys are doing with us. If people want to find out more, is there a place we should send them?
Yeah, you can go to soundself.com, soundself.com, and you can get in touch through us through that website. You can look at the research, and yeah, we'd love to hear from you. We'd love to work with you. If you're a listener and you're a practitioner, or you're just interested in learning more, we feel free to reach out. Yeah, thanks, Carl. Thanks, Mike, for having me on. And yeah.
Awesome. Well, can't wait to check back in a little bit, see how things are going with you and the company, but really appreciate your time, and we'll see you soon.
Yeah, thanks,
okay. Sounds good. Thank you.
Thanks so much for listening to the Wild Health Podcast. If you're a Wild Health patient, you might not know, but you have access to our referral program. This gets your friends and family 25% off Wild Health services. Just head to Clarity, and in the top right corner, you'll see Refer a Friend. Click there, and you'll be brought to a page with your referral code. Happy sharing.